What people can expect from working with me is the progressive and measurable improvement to their specific health problem that they're going through. So once people understand what caused their health problem, they're able to better make decisions. So part of what we do is we educate the patient. We want our patients to become experts in the condition they have. What is diabetes? How does it happen? What are the mechanisms involved? What's high blood pressure? How does our body manage blood pressure? What are the organ systems involved? What's chronic asthma? What is irritable bowel syndrome? What is this thing that they're calling migraine headaches? What makes a headache? So once patients understand the true physiological nature of their health problem, they're much better equipped to deal with it, and they make much better patients as well.